Hello and good afternoon. My name is Chididuru, and I'm going to be doing a presentation on integrative psychotherapy. Integrative psychotherapy is the integration of elements from different schools of psychotherapy in the treatment of a client. According to Psychology Today, integra- integrative therapy is a progressive form of psychotherapy that combines different therapeutic tools and approaches to fit the needs of individual client with an understanding of normal human development. And integrative therapies modifies standard treatments to fill in development gaps that affect each client in different ways. It can be used to treat various psychological problems like depression, anxiety, and personality disorder. My patient today, I'll present her a little bit background about her. Her name is Miriam. She's a 46-year-old female, Hispanic female. She presents today for follow-up because of complaint of poor appetite, depressed mood for 2 months. She doesn't have interest to go out or to have fun, to go out with family or friends. She has poor sleep pattern. She says she used to sleep 8 hours or more before, but now she finds it hard to sleep. And when she falls asleep, she sleeps only 4 hours. Miriam has a history of depression for 3 years. She currently takes Zola 50 milligram a day. She denies past suicidal or homicidal attempts, but she reported physical abuse by her father. Miriam used to work in a warehouse for 8 years, but the company is closing up and has laid off many of the employees, so Miriam lost her job. Miriam is angry at her boss and blames her boss for losing her job because she stated she lost her job and was very dedicated to it. Now she lost her source of income and her health insurance. Like I said before, there's history of mental abuse by her father, but she denies physical and sexual abuse. Miriam is still angry at her father. I have not spoken to her father or have contact with him for 15 years because of this. Miriam denies suicidal and homicidal ideations, and she denies hearing voices or see things. No history of substance abuse. She drinks alcohol occasionally, and she answered no to the cage questionnaires. Miriam has a history of type 2 diabetes and is controlled with medications, and her last A1C is 6.0. She is currently under care of her primary care doctor. Miriam is born a female and would like to be identified as a female. She was born and raised in Mexico by both parents with 6 siblings, but she moved to United States at 15 years ago. She's a high school graduate. Currently, she doesn't have a job, like I mentioned above. Father has a history of domestic violence, and she stated she always have negative thoughts about her father because of the abuse and her domestic violence issues. Miriam is divorced and lives alone. She has 3 adult children who are married and have their own homes. She has 8 grandchildren whom she's very close to. Miriam has family history of depression from her father's side. Father has a history of depression. No family history of suicide attempts. There's a family history of diabetes and hypertension. And the three psychotherapy that I'm going to be using on Miriam today are the cognitive behavioral therapy, the psychodynamic therapy, and the interpersonal therapy. First, I will start with the cognitive behavioral therapy, which is called the CBT. According to positive psychology, cognitive behavioral therapy helps the patient to change the negative styles of thinking and behaving that are often associated with depression. CBT focuses on recognizing and changing the thoughts, pattern, and behavior that leads to troublesome feeling. It helps the patient limit the distorted thinking by looking at worries more realistically. CBT is a talk therapy. It helps identify unhelpful thoughts and patterns and behavior and alter them to more effectively work towards a better goal. CBT focuses on a patient's current negative beliefs, evaluates how they affect their current and future behavior, and attempts to restructure the belief and change the outlook. This therapy is appropriate for Miriam because Miriam harbors negative thoughts towards her father. It's believed the therapy will help work for her to change her outlooks of her negative thoughts to change it into positive. CBT has 9 techniques and tools, which is journaling, unraveling cognitive distortions, cognitive restructuring, exposure and response prevention, in interoceptic exposure, nightmare exposure and rescripting, play the script until the end, progressive muscle relaxation and relaxed breathing. And the second therapy is the interpersonal therapy. Interpersonal therapy focuses on patients' disturbed personal relationships that both cause and exacerbate the depression. Interpersonal therapy is short and highly structured. It uses a manual to focus on interpersonal issues and depression. Why do I think this therapy is appropriate for Miriam is because patients still have negative thoughts and feelings towards her father. She's still angry at her father for abusing her, and it's believed that this therapy is hopefully will address her disturbed relationship with her father. And the third therapy is the psychodynamic therapy, which focuses on past unresolved conflicts and relationships and the impact they have on a patient's current situation. This is according to Jorgen Bad et al. They said this therapy is designed to help patients to explore the full range of their emotions, including feelings the patient may not be aware of, by making these unconscious elements of their life a part of their present experience. Psychodynamic therapy helps the patient understand how their behavior and mood are affected by unresolved issues and unconscious feeling. This therapy is appropriate for Miriam because she has a lot of unresolved conflicts with her father. She hasn't spoken to her father or seen her father for 15 years. She developed a broken relationship with him. She reported that she blamed her depression issues to the abuse from her father. So this therapy is choosing to address these issues. So now we're going to start the therapy with Miriam. I'm going to bring Miriam in. I'm going to introduce her so we can start the therapy. Hello, Miriam. How are you?
I'm okay, thanks.
Please introduce yourself.
I'm Miriam. I'm 46 years old.
Okay. Thank you, Miriam. As I said before, what brought you today is your depression and the issues you have towards your dad, right?
Yes.
Okay. First, we're going to start the cognitive behavioral therapy, which is the CBT, with Miriam. Like I mentioned before, this therapy helps patients' negative thoughts to change it into something positive. Okay, Miriam, we're going to start the first segment, which is the CBT. Tell me a particular time when you feel depressed.
I felt depressed and still do when my father had abused me mentally, always telling me I was stupid and I wasn't smart.
What is the negative thoughts that you have?
I really hate my father.
What is going through your mind then?
Thoughts about hurting myself.
Any physical symptoms you have?
Yes, I feel tired all the time, and I feel like I just don't have energy anymore.
How is your sleep?
My sleep is bad. It takes me forever to fall asleep, and when I do, I only sleep for 4 hours.
Okay. Tell me about your negative thoughts.
I hate my father, and I just feel so worthless.
Okay. Change these thoughts into positive thoughts, please.
That I don't hate my father, and that I am not worthless, and I am somebody.
Okay. And what change in attitude and change in behavior do you think you're going to make?
I'll start getting out of bed, finding more energy, start going out with my friends and my family to the movies.
Okay, good. So the goal of this therapy is to change Miriam's negative thinking into something positive. And now today she said her negative thoughts of hating her father, she's going to change it into I don't hate my father, I'm not worthless, I'm somebody. And she will start getting out of bed and she will start going out with her friends and her families and she start going to movie. Okay, so that is the goal of our CBT therapy, and we're going to have one session every week until we feel better, okay?
Okay.
Okay, thank you so very much. This is the end of our first segment, and we're going to move on to the second segment, which is the interpersonal therapy.
Okay.
Okay, like I said before, the interpersonal therapy focuses on patients' disturbed personal relationship, and Miriam has distorted personal relationship with her father. Okay, so first few weeks of interpersonal therapy, we'll be assessing for depression. Miriam, how long have you been depressed?
I've been depressed for 3 years.
Do you take medications for depression?
Yes, I take Zoloft, 50 milligrams every day.
Do you feel suicidal or homicidal?
No, I don't.
Any history of suicide attempts?
No.
Okay. Secondly, I am going to be orienting Miriam to focus and process her interpersonal issues and her problems, which are her strained relationship with her father and her feeling of worthlessness, which came from negative feelings she has about her father. Interpersonal therapy uses 5 tools. Clarification, which is helping patients to recognize and get beyond their own biases in understanding and describing their interpersonal issues. Supportive listening, which is listening to the patient and trying to hear their point of view. Role playing. Communication analysis. And the encouragement of affect. Encouragement of affect will let the patient experience unpleasant or unwanted feelings and emotions surrounding their interpersonal issues in a safe and therapeutic environment. When the patient do, it becomes easier to accept those feelings and emotions as part of the experience. The second part of interpersonal therapy focuses on sessions will be addressing the identified issues. Another important aspect is emphasis on termination. This therapy is a short therapy, like I mentioned before. So it's defined for a limited amount of time. The idea is for the patient to become aware of, for you to become aware of your ability to deal with interpersonal problems and that have kept you from being able to actively manage your depression.
Okay.
So this is a short therapy. We'll be meeting once a week, and at the end of this therapy, I want you to go home to use everything that we taught you. The positive, keep telling yourself you're somebody, you're not worthless, and you don't hate your father.
Okay.
We believe that by the time you start using all this, it's going to turn into something positive, okay?
Okay,
All right,
thanks.
thank you so very much. You can write it down, you can cram it anyhow, but you have to keep using it.
Okay,
Okay, thank you so very much, Miriam.
thanks.
This is the end of our second segment, and now we're going to start the third segment, which is the psychodynamic therapy. Like I said before, the psychodynamic therapy focuses on past unresolved conflicts and relationships and the impact they have on the patient. Yes, Miriam have unresolved conflicts and relationship issues she has with her father. Okay, to start this section, I have some questions for you, Miriam.
Okay.
Talk about whatever you have on your mind.
I feel so depressed. I can't shake the depression. I keep thinking that my depression really stems from my feelings about my dad, and the depression feelings just makes me feel so worthless.
Okay. Tell me about feelings that are troubling or threatening to you.
The feeling that my father mentally abused me, I still just can't get it out of my mind. My feelings that are very worthless are troubling to me.
I will address some defense mechanisms that I have noticed with you. I see that you try to change the topic whenever I try to address the mental abuse by your father. The other time you missed a therapy session because I told you we were going to address the issue of your feeling worthless. What do you say about this?
I just don't really want to talk about these incidents. It just makes me feel more depressed.
Okay. Well, like I said, the goal of this therapy is for you to go home and keep using the positiveness to work on this issue of negativeness, turning the negative into positive. And until I see you again next week, okay?
Okay.
All right. Thank you so very much. And this is the end of our third segment. And hopefully, Miriam will use all the positivities that we talked about today so that she can, turn her negatives into positive and be able to help her with her depression. Okay?
Okay.
All right. Thank you so very much, Miriam.
You're welcome.
Okay. And now I'm going to talk about how an example of how these 3 different therapies can be used to support cultural and diversity in my patient or possible adaptation that may be required. One study that article that I read noted that therapy with Latino clients was less effective when the therapist was misunderstood as distant. So he's trying to say that when you're dealing with a Hispanic population, don't try to be distant, be close and friendly. And I put that into consideration when dealing with Miriam because I put her Hispanic background into consideration. And I was open to her. I didn't try to be distant. I tried to be friendly, but at the same time, try to be professional. And this is one way you can put a client's cultural background into consideration. It's generally believed also that openly showing respect for someone's culture and belief can result in a more effective treatment and a more positive outcome for both client and therapist. So I put Miriam's Hispanic culture into consideration, and I respected my client. And the goal is that the therapy will work for her because she will know I acted in a professional way and I respected her culture. And the three therapists show close interaction between me and Miriam, and it will benefit this patient with her Hispanic background as she will feel respected and be able to, accept the therapy, which will lead to a positive change of thought for her. Okay, in summary, usually the first line of treatment for mental illness is often psychotherapy because it's considered harmless in comparison to drug treatment. This is according to Linden and Schumann, 2014. Psychotherapy is believed to have less side effects like compared to medication. Zoloft, Prozac, and name them. They have a lot of side effects. So that's why usually it's encouraged to use psychotherapy, especially with patients who have mild and moderate symptoms. Hopefully it works for them. Or sometimes you can do medication in collaboration with psychotherapy, and it works really great. When different therapies are combined for treatment of psychological disorders, it tends to have favorable impact and make a positive change of thinking for the patient because each one of the therapies bring in a different approach with the main goal of changing the patient's negative thinking into a positive one. As they said, two heads are better than one. So using 2 or 3 therapies, especially these 3 therapies that I use, the cognitive behavioral therapy, the interpersonal therapy, and the psychodynamic therapy, all 3 of them, their main goal, in one way or the other, they try to work on negative thoughts, changing them into something positive. And for my patient, Miriam, she's great on negative thinking because of her abuse, and this has been affecting her relationship with men, her marriage, her job, and her daily life, and in managing her depression. So it's believed that these 3 therapies that works on negative thoughts will help her curb her negativity and have her have a more positive thoughts and thinking so she can live a better life and can control her depression. That is the goal. Thank you for listening. This is Chidi Duru, DMP student, Bremen University, signing off, and have a good day. Bye.